Hey guys, I'm just going to do a quick video on prepping Viera's enzymes. I would suggest you use gloves. I don't, but just to protect your hands from the active enzyme. First I sanitize, alcohol swab, and this is her tube, extension tube, that we use to administer into her G-tube. So I give that a good clean. And then I'll close the big port. Take a 10 ml syringe. And now you're going to want to prime the tube first, just so you don't push air into her stomach at first. So I just fill a syringe, and then there's a small port right here you use to, and then you're just going to push water through it until it comes out this end. So you can use a cup. I usually do it into the sink, but until it comes out. And then once that, you're going to clip that shut. Take the syringe out, and then close the small medical port. Then that's primed, ready to go. Next, you're going to, I usually use about 5 mils in the syringe to mix her enzymes. We're going to do 2 enzymes, and I like to use these small little mixing cups. So I put 5 mils of water in there. These are her enzymes. They're active enzymes, so you're going to want to try to wear gloves or a mask too. I know you guys wear masks at work, so that'll work perfect, because you're not going to want to breathe this stuff in. So this is what they look like. You're just going to open them up into here, trying to get all of it out. And the next one. Now I would suggest putting the water in first before you put the powder in, because if you put the powder in first in the water, it clumps. So I use just a regular plastic spoon, and I clean the end that I'm going to stir. And I use the end because it works way better in the cup. So then I just hold it away from my face so I'm not breathing it in, and I stir it around. And when you use the end of the spoon like this, it kind of scrapes the side of the cup so the enzymes fall back into the water and it really mixes them in well. Give it a good mix, 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 mix. Just try to scrape anything that's come up on the sides back into the water. Okay, and it's hard to see, but it's all pretty much mixed up in there. So now I just take the syringe that we used to put the 5 mils water in there and suck it up, and then I kind of use the syringe to push it around into the corner to try to get whatever. You don't be worried if you don't get it all. I mean, it's gonna happen. And then I just give the top a wipe, and then you're gonna want to make sure, because there's gonna be air on the top, to try to purge that out the best you can without losing any enzymes. Okay, now that's ready to go. So when you give Viera her enzymes, you're gonna have to flush the medication out of the tube as well. So I use a second syringe, and I just fill this one with water. Okay, so we have our medication, enzymes, and our water. Next video, I'll show you how to administer them into her.